It's the time of year for springtime allergies, runny noses, itchy eyes, and even a cough. In the midst of the COVID-19 pandemic, it's critically important to know the differences in symptoms. Joining us this morning by Skype is Dr. Mary Schmidt, Associate Professor of Clinical Medicine, VCU, the INOVA campus. It's great to see you this morning, Dr. Schmidt.
Hi, good to see you too. Thank you for having me.
It's our pleasure. You know, this is a conversation right now that is coming front and center for so many reasons, but as allergy season is in full swing or really getting pretty heavy, you want to be able to distinguish the differences, certainly in symptoms and how to react.
Exactly. And I have to tell people we now understand a little bit more as we look back at the data from China and see what's happening here is that the symptoms really can be similar and people can be asymptomatic and shed this virus. They can be early in the prodrome with no symptoms, later get symptoms and shed it. So I would say the difference between will be the reaction to an antihistamine. So if you take an antihistamine and your symptoms go away, if you use a nasal spray, an antihistamine nasal spray, which are prescribed by a physician, but if you use an antihistamine, your symptoms go away and now it's an allergy, you need to assume this could be COVID-19 if your symptoms don't go away.
That's a pretty profound thing to share, certainly. So the advice that you're offering here is take that antihistamine. Can you advise maybe how quickly you might see resolution once you've taken an antihistamine? And then if it is continuing after that, that's when you need to consider something else.
Correct. About 4 hours for an oral tablet. There are ready tabs or liquid that act within an hour to 2 hours.
Wow. And so with that rapid of maybe a resolution of your symptoms, you would know that that kind of resolves it and it's allergies. Sometimes though, I find like you're doubling up on allergy medicine and a nasal spray and that sort of thing. Of course, that's up to your doctor, but do you think sometimes maybe just an over-the-counter antihistamine might not be doing the trick right away that quickly?
Well, people at this point in time, I would use experience. Those people that have a terrible time with allergies, they already know. They've been calling me and saying, should I take this? Should I not take that? And they're very aware of that. For somebody who's a new allergy sufferer, they should just try something over the counter.
Right. And
Clarence and Allegra the store generic brand would be fine also.
The usual suspects that can bring you a little bit of relief for sure.
Yes.
And for everybody watching right now who may be new to the area, this particular area of Central Virginia, I understand is particularly profound with allergies. And if you didn't have them before, you may be experiencing things now as spring is on the horizon. If you've taken an antihistamine, doctor, and situation does not resolve, what is next?
We're having a little problem still in Virginia getting tests, but find out, call your primary care physician. You can even call the emergency room or the hospital. Many hospitals now are setting up testing areas. It's good to get tested because when somebody knows that they have COVID-19, they need to really actively stay away from people. Unfortunately, we have too many people walking around with this and spreading it to a lot of other people, and they're doing this innocently. But the more the people that we know have it, the better we can control this, to be quite honest.
Yeah, and I noticed the words of wisdom there that you shared are call your primary care office first, or even you mentioned calling the ER. So that reinforces that idea of not moving around and continuing social distancing.
Correct.
Yeah.
Or the hospital can tell you where to get tested if the hospital has places. Many hospitals are now opening up their clinics, urgent care clinics, to do some testing. Most of the primary care doctors actually can't because they weren't prepared for something like this and they don't have that PPE, the really protective face mask and gowns to be able to test people. So many primary care doctors are really frustrated about this situation.
With allergies in full swing, are there insights that you offer to help people find relief and stay well and maybe skirt some of that too? I mean, we do have that advice of if you're out in the pollen, you know, come in, take everything off, get cleaned up and that sort of thing.
You know, it's the same thing actually for COVID-19 of what you need to do if you go out into public. Certainly staying inside is what we're all told to do. And there's so many wonderful things to do to stay inside now. Museums have ways of looking at their contents online, exercise classes, Zooms, products that are giving people opportunities to do things and connect with others. So there's a lot to do inside. If you're really heavily affected by allergies, that is an option. But I like the idea of taking clothes off. Certainly hair needs to be brushed and washed. Coming in after being outside in a group situation, if you're that designated person told, to go shopping, because we all know whatever delivery we like to get might not be coming anytime soon, seems to be the problem. So sometimes somebody has to be the designated shopper, and when they come in, they need to leave their shoes at the door, take their clothes off. Those clothes need to go in the wash. They have a mask on, and masks are good for people with allergies too. If you have a mask on, you have to take it off from the inside, but not touch it. And I've been recommending the hottest place, and coronavirus does not like the heat, is spray it with some disinfectant and leave it facing up in the dashboard of the car. And then those clothes actually need to go in the wash, whether it's allergy pollen or COVID-19 on your clothes. And of course, wash your hands.
Yeah, wash your hands, wash them again, and keep them washed. That's for sure. Yeah, I think about the pollen coming in. If you've been outside and maybe you're just getting refreshed, you got to remember to wash your hair, because then that's what you're on your pillow and pollen's going everywhere. So make sure that it's the whole kit and caboodle.
And if you're in the woods, it's tick season, everybody. Really, we have a big tick problem in Virginia, so that helps. Brushing your hair and washing your hair after being out near brush, bushes, and wooded areas is helpful getting those ticks out.
Across the board, it sounds certainly like vigilance is key, knowing the ways to tackle these different areas. Doctor, if we should find ourselves in a situation where it's not allergies, we've made that call, perhaps you've been tested, are there things that we should know about taking care and keeping ourselves contained and kind of quarantined separately?
The biggest thing I want to impress upon people is that, you stay inside. If you're infected and you have family members with you, you really have to stay in your room. I recommend giving everybody their own bathroom if they can, because studies show that this virus just spreads all over the bathroom. It's on the floor, it's on the counters, it's in the sink. And so giving people their own bathrooms is important. And COVID-19, and actually we now know that the virus can be shed in bowel movements, so cleaning the area really well after having that is going to be really helpful. If families need to share bathrooms, I would recommend that whoever's in there gets taught how to clean the bathroom properly and does it before the next person comes in. I'd also like to let people know about when to go to the emergency room, because I'm concerned that there are people dying because they don't get there quick enough. This virus causes a severe pneumonia, and one of the terrible things that we've learned is opposed to being able to care for people and seeing it happen. The demise happens really quickly. So somebody can have a really bad cough, maybe if they have asthma, a little wheezing, and it turns into a severe pneumonia, then respiratory distress very, very quickly. So any signs of a sense of struggling breathing, a cough that can't be controlled, get to know how many breaths you do a minute. And if you find yourself having to take more of those and you've been feeling a little feverish, we know 30% of people don't have a fever over 100.4 with this, and that population can get this sick, particularly if they have one of the high-risk conditions. So for those people, get to know what it feels like to be normal, and if something really changes, you need to get to the emergency room, and if you're really struggling, call 911.
Incredible insight. And doctor, I want to ask you a pretty targeted question with that. If it starts to devolve into pneumonia, you mentioned that happens very quickly. People have different time perspectives. How quickly is very quickly?
Hours.
Wow. Wow. Thank you so much for making time for us this morning, doctor. Great insights.
Oh, thank you for having me.
Appreciate it.
Thanks.
Great conversation. Dr. Mary Schmidt speaking with us this morning. For more information, we'll have a direct link on our show website later today, WTVR.com/VTM. Stay tuned. We'll be right back with more.